Hi, welcome everybody. This is the Colorado Quick Care Card, bringing awareness to postpartum care presentation. And you are seeing this presentation because your hospital has decided to implement this program. I am Carrie Ricard. I am a program manager for CPCQC, specifically for our SPARK program, which is our postpartum discharge transition.
Hi, everyone. My name is Ashley Gates, and I'm a Quality Improvement Advisor at CPCQC on the Spark program, and I am also a registered nurse.
All right, let's go ahead and start. At the Colorado Perinatal Care Quality Collaborative, or CPCQC for short, we are on a mission to ensure that every mother, birthing individual, or other families in Colorado receive culturally relevant, safe, equitable, high quality care, no matter who they are or where they live. We work with other Colorado partnerships across the perinatal healthcare system, state health agencies, insurers, provider associations, and community advocacy groups to help improve the care of pregnant and postpartum birthing people and babies and ending preventable maternal and infant death injuries. This is just a picture of our team, which is still expanding. And there are 36 other perinatal quality collaboratives nationwide. We in Colorado, we have the Colorado Perinatal Care Quality Collaborative, CPC for short. Our vision is that we imagine a world where everyone has access to the healthiest pregnancy and delivery experience possible. And our mission is we work with Colorado healthcare providers, state agencies, insurers, and community groups to improve care for mothers and babies and prevent avoidable deaths and injuries. At CPCQC, we have 4 QI programs, all of which would use a QI framework to roll out evidence-based interventions at our Colorado birthing hospitals. I'm going to take a moment to talk about why this card is important. And I also just want to note that there is a trigger warning. Today's presentation discusses maternal death, substance use, suicide, and interpersonal violence. If this is a difficult topic for you, please do what you need to do to take care of yourself during or after this presentation. And we also have some resources for you. I want to start by centering us around some definitions that will be used when reviewing the data. Pregnancy-associated deaths are all deaths that occurred during the pregnancy or within 1 year of the end of pregnancy, regardless of the cause of death. Pregnancy can end in live birth, stillborn, fetal death, miscarriage, or abortion. Pregnancy-related deaths, a subset of pregnancy-associated deaths, where the death is due to a pregnancy complication, a chain of events initiated by pregnancy, or the aggravation of an unrelated condition by psychological effects of pregnancy. In Colorado, we use the term maternal mortality broadly to cover both subsets. Regardless of what definition a death falls under, I want everyone to be aware that this time period of a person's life is a vulnerable time period, and a person is at higher risk of death purely from just being pregnant or postpartum. These are the maternal mortality rates nationally. It is divided by associated and related deaths. But what you can see is that the rates are trending upwards over the years. Of note, the United States has one of the highest maternal mortality rates for an industrialized country. This chart shows the top causes of maternal deaths in Colorado. It also mirrors nationwide statistics. The leading cause of maternal mortality in Colorado is suicide, followed by unintentional overdose, then OB complications, and then homicide. The Colorado Maternal Mortality Review Committee deems that 89% of these deaths are preventable. So we have an opportunity to educate patients and non-OB providers about these complications and risks. This will help make sure that patients are aware of these complications and are equipped to navigate them should they ever encounter them. This chart shows the timing of pregnancy-related deaths. As you can see, the majority of these deaths occur in that postpartum period, and more specifically, days 43 to 365 days postpartum. So day 42 is when people have that one standard postpartum care visit with their medical provider. And this means that patients in this time frame need medical care and they are unlikely to return to the OB provider. Of note, a patient in that 43-day to 365 time frame who still needs care for OB provider familiar with OB complications is unlikely to receive that care from those providers. This highlights the importance of finding a way to easily identify a patient as being postpartum and the need for easy access to information on OB care and for non-OB providers. So this slide dives into how location also impacts maternal mortality. As you can see, people who live in rural or frontier communities are at higher risk for mortality. In the state of Colorado, we have a 37.5% maternity care desert, which is higher than the national average. This highlights, once again, the importance for accessible information and early identification of OB complications so patients can receive the right care more quickly. Patients who live in these maternity care deserts are unlikely to receive follow-up from OB care or from an OB provider. If they are 3 weeks postpartum and experience any issues, they're not driving all the way back to those hospitals they delivered at, but going to their local EDs for help. And those rural EDs are not always equipped to navigate OB complications. We discussed some maternal mortality data already. However, we thought it was important to share that experiencing a complication in the perinatal period is common, even when it doesn't result in death. This highlights the importance of patients being able to recognize complications when they are experiencing and when and where to get help. So 1 out of 6 people will experience a mental health condition during pregnancy or the first year after birth. And 1 out of 4 people report using substances in that first year postpartum. Approximately 1 out of 10 people had an ED visit or readmission within that first 3 weeks of delivery. So lastly, in the postpartum period, there is one standard postpartum visit. Study shows that almost 60% of these people don't actually attend that one visit. This highlights the importance of clear education on postpartum warning signs and access to resources when discharging from the hospital. All those stats go to say that we are missing the mark somewhere, and there's a greater need for recognition of OB patients and an understanding of complications they experience. Therefore, we are excited to introduce to you the Quick Care Card and its benefits.
So this project includes an alert card featuring QR codes, educational resources, and key warning signs for postpartum complications. This initiative promotes patient safety, continuity of care, and awareness across emergency response systems. As mentioned in the previous data slides, it's highly likely that a patient may not receive emergent care during the perinatal period from an OB-trained provider. Specialty areas can be siloed, and there is a gap in multidisciplinary connections between OB and ED units. Especially if a hospital is without an L&D unit, those EDs are even higher risk for not having evidence-based protocols for screenings for recent pregnancy or treating OB-related complications. This card can help navigate that issue. On the front of the card, it's just some quick information that's relevant to the patient, like their delivery or due date. It talks about their doctor and their midwife and their nearest emergency room. And on the back side of the card, there are warning signs that a patient should watch for that are divided by who you need to follow up for. So what complication you're experiencing, and is it appropriate to call your doctor or 911? And now I want to introduce you to some of the details on the card itself. I'm going to start with the website that is linked to the QR code on the front of the card. The website itself is what we think makes this card really special. If you scan the QR code on this slide, you can follow along as we tell you about the site. If you do scan the QR code, just know that it's going to take you to the mobile site, which varies a little bit in formatting from the desktop version that I'll be showing you guys. But this is our landing page. And on the next slide, we show that we have a video that is in English with Spanish subtitles, and it explains what the card is and how to use it. This is really helpful to ensure that the message is standardized to our patients receiving the card. The goal for this card is to distribute it statewide, so ensuring that patients receiving the same message behind the importance of and utility of this card is really important. Additionally, on the landing page, you can click into resources for either patients or healthcare providers. When you click into the patient section, you are brought here. You will see important warning signs to watch for in a simple and clearly explained format. And additionally, on this same page, there are quick links for patients to access statewide resources related to health and well-being. The hope is that these resources can help support the patient with common OB challenges related to perinatal mental health conditions, substance use disorders, social drivers of health, and interpersonal violence. We have foundational information on here right now and are excited to expand these resources over time. All this information is easily accessible to patients with the card at any moment of time. We also ask that you suggest to your patients that they favorite this website on their phone, and that is a great way to make sure they can get to it anytime. We know that people are scrolling on their phones when in bed or feeding their baby, and why not use that time to be productive and learn about some resources to help support them in the postpartum period. If you go back to the main landing page and click into the healthcare provider resources, you're brought here. While this slide only shows a few resources, there are many evidence-based algorithms for treating OB complications and emergencies on here. We know an online resource doesn't replace training, but we do know that OB emergencies are high acuity situations and potentially something some emergency providers don't encounter frequently, especially depending on their location. Ensuring that they have easy access to the most current evidence-based materials in an emergency can be life-saving. This page also links to helplines for providers like the Colorado Prosper Mental Health Helpline, where providers who don't specialize in mental health can connect with mental health providers to receive guidance on treating mental health complications. Now we'll take a bit of time to talk about how to roll out the Quick Care card at a site. In addition to the card and the QR code, we have a Colorado Quick Care card toolkit where your team can access useful tools for rolling out the card at your site. This is a picture of the toolkit, and if you scan the QR code, it takes you to that toolkit. In the toolkit, we have the Quick Care card in multiple formats. We have tools like the card that is translated and resources for you guys. We have many patient-facing resources in this toolkit, like handouts that are explaining the why behind the card and ED signs to hang up and triage. We also have lots of staff-facing resources, like handouts explaining this initiative for OB providers and for ED providers. And we have translated all the patient-facing materials to the top 5 languages in Colorado, so sites don't have to fund that themselves. And we are already looking into adding more languages to that toolkit. These are some examples of the handouts we have. Like mentioned before, they include healthcare provider handouts, patient handouts, and triage signs, and many more. And again, we have them translated to ensure equitable access to this resource. This toolkit is for teams to use in whatever way they feel is helpful. Now I'm just going to talk a little bit about what your role in the Quick Care card is. We ask that you ensure that every patient receives a Quick Care card and that they promptly place it into their wallets. We know this can fall into the bottom of a bag or end up in a pile of paperwork that they're sent home. It's really important that this makes it into their wallet when they're at the hospital. We also ask that you give them a handout to tell them about the importance of the card. So we want you guys to be aware that this initiative exists and that your hospital is participating in it, and just ensure the patients get what they need from it, and that the patients know that they are at an increased risk postpartum, and what the importance is for notifying their care provider that of pregnancy or delivery when seeking care. We, again, recommend that this card is given to patients and put right into their wallet. And we encourage you to educate the patients to present the card to their healthcare providers anytime they receive medical care during pregnancy or the postpartum period. So a really great place for this to live is with their ID or their insurance card, because we know those are cards that EMS is looking at if they encounter this patient out in the field, or that the ED is asking for on admission to the hospital. And I just want to reinforce that you play an important role in reducing maternal mortality in Colorado. You can share the card, you can start the conversation, and you can help change outcomes. We thank you for listening to this presentation and being part of the rollout of this program. Our contact information is here if you have any questions.